This recording is going to cover the external iliac arteries and the lower extremities. The external iliac artery is larger than the femoral artery. It extends toward the lower extremities. It passes through or goes under the inguinal ligament. It's a continuation of the common iliac artery. It will continue as the femoral artery, and it will terminate at a point behind the center of the inguinal ligament. It lies along the medial border of the psoas major muscles. It is used in embalming in an autopsied body to get complete distribution of the lower extremities. The femoral triangle or Scarpas triangle. The femoral triangle is located in the anterior superior portion of the upper one-third of the thigh. The boundaries are as follows. The superior boundary or the base is formed by the inguinal ligament. The lateral boundary is formed by the sartorius muscle. The medial boundary is formed by the adductor longus muscle. The femoral triangle contains the following vessels or structures. The femoral vein lies medial and deep to the femoral artery. The femoral artery is lateral and superficial to the femoral vein. The femoral nerve, we really don't need to know the location of this. So how are you going to remember the order of the vessels? By VAN, V-A-N, vein, artery, and nerve. VAN will only work in the femoral triangle when you're going medial to lateral. Adductors Canal is also known as Hunter's Canal. It is located in the middle one-third of the thigh. It starts at the apex of the femoral triangle and runs through the adductor magnus muscle. The femoral artery runs through the Adductors Canal as well as the femoral triangle. The femoral artery begins at a point behind the center of the inguinal ligament and terminates at the opening in the adductor magnus muscle. The femoral artery is a continuation of the external iliac artery, and the femoral artery continues as the popliteal artery. It is a branch of the external iliac artery. The popliteal artery is placed at the back of the knee. It begins at the opening of the adductor magnus muscle and terminates at the lower border of the popliteus muscle. It is a continuation of the femoral arteries, and it is a branch of the femoral artery. The popliteal artery will bifurcate into the anterior tibial artery and the posterior tibial artery. The anterior tibial artery will go down the front or the anterior part of the leg. It starts at the lower border of the popliteus muscle and terminates at a point in front of the middle of the ankle joint. It branches into the Dorsalis Pedis artery, or you can say it continues as the Dorsalis Pedis artery. The posterior tibial artery goes down the back of the leg and terminates at the heel. It starts at the lower border of the popliteus muscle and terminates at a point over and between the medial malleolus and the calcaneus bone, which is what we call our heel bone. The posterior tibial artery will bifurcate into the medial plantar artery and the lateral plantar artery. Let's locate the medial malleolus together. Take your hand and place it on the small bump on the medial side of the ankle. Do you feel that? That's the medial malleolus. So now you have an idea of where the posterior tibial artery terminates. The Dorsalis Pedis artery is a continuation of the anterior tibial artery and is located on the anterior superior part of the foot. The medial plantar artery supplies the medial aspect of the sole of the foot, which is known as the plantar surface. The lateral plantar artery supplies the lateral aspect of the sole of the foot. Again, it is known as the plantar surface. So how about it? Do you think you can trace the arterial blood flow to the lower extremities? Let's give it a try. Okay, we're going to start in the left ventricle. Blood is going to flow into the ascending aorta, into the arch, to the thoracic aorta, down to the abdominal, into the common iliac artery. Blood will flow into the external iliac artery, to the femoral artery, to the popliteal artery. The popliteal artery will now bifurcate into the anterior tibial and the posterior tibial arteries. The anterior tibial artery will continue as or branch into the Dorsalis Pedis. The posterior tibial artery will bifurcate into the medial and lateral plantar arteries. Now you will have branches of the Dorsalis Pedis, medial plantar artery, and the lateral plantar artery. They will anastomose and give us the superficial and deep volar arches. We have to get blood down into the toes. They are known as digits, and just as in the fingers, we will call them the digital arteries. Great job. Now we have to get that blood back to the heart. Just like in the upper extremities, we have two different venous returns, the deep venous return and a superficial venous return. Remember that deep return will be the reverse of the arterial flow, and the veins will have the same names as the arteries. So we're going to start in the toes with our digital veins. We're going to take the deep venous plantar arch. Blood will flow into the Dorsalis Pedis vein, and that will flow into the anterior tibial vein. At the same time, blood will come back on the plantar surface of the foot through the medial plantar vein and the lateral plantar vein. The medial plantar vein and the lateral plantar vein will form the posterior tibial vein. The anterior tibial vein and the posterior tibial vein will come together to form the popliteal vein. Blood will flow from the popliteal vein into the femoral vein. The femoral vein will flow into or is a tributary to the external iliac vein, which will then flow into the common iliac vein, into the IVC, into the right atria. Now remember, veins have tributaries, which means flows into. Now we'll take the superficial return. The two superficial veins are the great saphenous or saphenous vein and the small saphenous or saphenous vein. The great saphenous is the medial vein of the lower extremity. The small saphenous vein is the lateral vein of the lower extremity. So now we are in the toes again with the digital veins. Now we're going to take the superficial venous plantar arch. Blood will flow into the great saphenous vein. The great saphenous vein will go all the way up into the femoral vein. The small saphenous vein will flow into the popliteal vein. The popliteal vein will take that blood and bring it into the femoral vein. Now we have all the blood in the femoral vein, and that will go into the external iliac vein, to the common iliac vein, to the IVC, back on up to the right atrium. Some important points to remember. The aorta is the largest artery in the body, and it will penetrate the diaphragm through the aortic orifice. The great saphenous vein is the longest vein in the body. The IVC is the widest vein in the body. It is formed by the right and left common iliac vein at L5, or the fifth lumbar vertebrae. It runs very close to the spine and is located to the right of the aorta. It is the vena comite or vena comitens to the abdominal aorta. It penetrates the diaphragm through the IVC orifice. It returns venous blood back to the right area from those areas below the diaphragm, and it will receive the right and left renal vein, the right ovarian vein, the right testicular or spermatic vein, and the right adrenal or suprarenal vein. The common iliac vein is formed by the external iliac vein and the internal iliac vein.